For purposes of audio description for the blind and visually impaired, this is an audio described portion of an October 2021 meeting of the Advisory Council on Alzheimer's Research, Care, and Services. It is a virtual meeting with participants displayed in the right portion of the screen and presentation slides displayed in the left portion of the screen. Council member Carrie Mulkey is speaking.
So now we'll shift to talk about how to build quality dementia care through quality direct care jobs by welcoming Stephen McCall. He's a data and policy analyst at PHI. In this capacity, he studies and writes about a variety of issues facing the direct care workforce with a goal of reforming state and national policies. Stephen also tracks workforce trends in policy and practice at the local, state, and national levels and monitors workforce demographics, matching service registries, job quality indicators, and occupational training standards in all 50 states. In addition to authoring and supporting a variety of PHI's publications, Stephen provides technical assistance to researchers, employers, and policy experts from around the country. So please join me in welcoming Stephen McCall now.
A slide is displayed with the title, Building Quality Dementia Care Through Quality Direct Care Jobs, a presentation by Stephen McCall, Data and Policy Analyst at PHI.
Thank you so much, Carrie, and to everyone who attended and everyone who's speaking today. This is just as enriching as, for me as it is for you. Today, I'm going to take some time to talk through a really important topic, and that is the inextricable link between direct care job quality and dementia care quality. First, I'd like to share a high-level overview of this workforce, including the demographic composition of direct care workers, demand for this workforce, the challenges that they're facing in the field, and what we can expect for the future. And then finally, I'd like to share a framework for thinking about direct care job quality and how various job quality interventions would improve care for people living with dementia. Next slide, please.
A photo is displayed of a nurse and elderly patient in a wheelchair, both smiling, and the logo for PHI.
Before we launch into the content, I'd like to first introduce you to my organization, PHI, for those of you who aren't familiar. We're a nonprofit research and consulting firm based in the Bronx, but nationally focused. And we recognize that strong relationships between direct care workers and long-term care consumers are really at the heart of quality long-term services and supports. But we can only achieve those strong relationships when workers receive a living wage, high-quality training, and overall respect for their very important roles in this field. Next slide, please.
A slide is displayed with a graphic. A colored circle in the middle is surrounded by 6 icons, 3 on the top portion of the screen titled Our Approach, a 360-degree perspective. The icons are labeled Research, Consulting, and Advocacy. On the bottom half of the screen, 3 more icons are titled Our Knowledge, over 30 years. The icons are labeled Original Data, Providers, and NYC Affiliate.
We strive for this vision of job quality and care quality by producing original data and analysis, advocating for this workforce at every level of government, and working directly with employers on the ground to implement elements of a high-quality direct care job. Importantly, these various elements of research, advocacy, and consulting with employers all inform each other. So the high-level work that we do is very much informed by the on-the-ground experiences of employers and workers. That 360-degree approach is informed by 30 years of original data collection and analysis, again, working directly with providers in a range of geographic locations, and also pilot testing interventions and learning from our New York City affiliate, Cooperative Home Care Associates, which is a worker-owned home care agency in the Bronx. Next slide, please.
A slide is displayed with the title, Who are Direct Care Workers? ?
So let's start with a big picture question. Who are direct care workers in the US? Next slide, please. First, this is really gendered work. 9 in 10 direct care workers are women. Next slide, please. This is a workforce also primarily comprised of people of color. 3 in 5 direct care workers are people of color. Next slide, please. And 1 in 4 are immigrants, meaning they were born in another country, whether they're documented or undocumented or full US citizens now. So as a workforce primarily comprised of women, people of color, and immigrants, these workers face unique challenges. First, at a systemic level, their labor has been historically undervalued. There are direct lineages historically between slavery in the 19th century, the exclusion of particularly home care workers from minimum wage and overtime laws, and job quality today. But also on the ground, these workers might require additional supports, for example, with childcare, with the language that they speak or immigration-related challenges, and the systemic racism that they experience in their daily lives. So Black feminists have provided us with the term to sort of describe these intersecting phenomena, right? They lie at the intersection of all of these various challenges that they face. And also, this all has implications for people living with dementia as well, because of the poor job quality that's so tied to the demographic characteristics of this workforce. We've seen historic underinvestment in their jobs and in care for people living with dementia. Next slide, please. So now let's turn to workforce trends, namely that this is a large, growing, and changing workforce. Next slide.
A slide is displayed with a line graph. The title says, "The direct care workforce added nearly 1.5 million jobs from 2010 to 2020. The line graph displays the number 3,119,960 jobs in 2010, with the line slowly growing to 2020 with the number 4,582,540.
From 2010 to 2020, so basically the last decade, this workforce added nearly 1.5 million new jobs. This is now the largest workforce collectively in the country. You can also see there's a slight increase from 16 to 17. That was primarily due to a methodological change where more consumer-directed workers are included in these figures. But as you can see, in the preceding years before that methodological change, we're still seeing this steady increase in demand for this workforce. Next slide, please.
A slide is displayed with the same line graph as before with additional information. The title is "From 2010 to 2020, more than 9 in 10 new direct care jobs were in home care." The line graph displays that new jobs were created in 4 different categories: home care, nursing homes, residential care homes, and other industries, with the largest portion being in home care.
And when we look at the composition of the direct care workforce over time, we see that most of that growth over the past decade was caused by growth in the home care workforce. And in fact, we see modest growth for residential care aides in residential communities like assisted living and CCRCs. And we actually saw a slight decrease in the number of nursing assistants, signaling the impact of state rebalancing efforts on the workforce. Next slide, please.
A slide is displayed with the title, "3 primary factors contributed to growth in the home care workforce." 1. Growing population of older adults. 2. Consumer preferences for care. And 3. Policy and programmatic changes.
Regarding this astronomical growth in the home care workforce, there are 3 primary factors that drove that growth. First, there's this rapidly growing population of older adults. This is a familiar trend for many of us on the call. And older adults today prefer to receive long-term care at home. That was probably always the case. The difference is that our policies and programs have caught up to those consumer preferences. Policymakers have really demonstrated that not only can these programs and home and community-based services better meet the needs of consumers, but they can also be more cost-effective than residential or nursing home care. And this is all true for people living with dementia as well. This population is also growing. and many are accessing public programs to receive services at home in line with their preferences for care. Next slide, please.
A slide is displayed with a bar graph. The title says people with Alzheimer's or other dementias constitute a large share of long-term care consumers. The bar graph displays that people with Alzheimer's constitute 31% of adult day services consumers, 32% of home health agency consumers, 42% of residential care community consumers, 45% of hospice consumers, and 48% of nursing home consumers.
As a result of those shifts in the composition of the workforce and in places of receiving care, direct care workers have a role in assisting and supporting people living with dementia across all long-term care settings. Although long-term care consumers living with dementia still constitute a larger share of the nursing home population as compared to the population receiving HCBS, we're still looking at about a third of people receiving HCBS living with dementia. Next slide, please.
A slide is displayed with the title, "What are the challenges direct care workers face?" ?
So clearly there's a growing need for this workforce, but job quality has simply not kept up. So now let's turn to the challenges that they're facing in the field. Next slide, please.
A slide is displayed with a bar graph. The title says, "Direct care worker median wages have stagnated over the past decade." The bar graph displays that home care workers earned $11.23 an hour in 2010 and $12.98 an hour in 2020. Residential care homes workers earned $12.28 an hour in 2010 and $13.45 an hour in 2020. Nursing home workers earned $13.33 an hour in 2010 and $14.48 an hour in 2020. All direct care workers earned $12.53 in 2010 and $13.56 an hour in 2020.
First, wages across the direct care workforce, while they've increased a little bit over the past decade, have basically stagnated. Even in home care, where demand is the highest and wages have increased the most, they're still facing immense economic instability. They're still typically making less than $13 an hour, and we're seeing huge corporations and large chains like McDonald's, Target, Walmart, Quick Trip in Wisconsin, those that already came up. Employers are increasing their wages to attract workers, especially in this tight labor market that characterizes the pandemic economic recovery. Part of the reason why long-term care employers aren't keeping up is that, as was already noted, they're really depending on public funds to invest in the workforce. So part of the lag in investment in their wages is a lag in the investment at the state level in direct care job quality. Next slide, please. Compensation, though, is comprised of more than just wages. It's also about hours. We see that part-time hours are really quite common in the field, more so in home care than, for example, nursing home care. But still, across this workforce, 1 in 3 workers are working part-time. Here, we've defined that as fewer than 35 hours per week. Next slide, please. Those low wages, combined with part-time hours, mean that their median annual earnings are just $20,200 a year. Next slide, please. But it's not as if these low-earning workers are living in well-resourced households. When we think about poverty rates, right, so workers taking into account their whole family income and the size of their households, we see that 44% are living in or near poverty, defined as below 200% of the federal poverty level, the typical threshold for many public benefits. Next slide, please.
A slide is displayed with a bar graph. The title says, "Nearly half of direct care workers rely on some form of public assistance." The bar graph displays that 45% of direct care workers rely on any public assistance, 28% of direct care workers rely on Medicaid, 25% of direct care workers rely on food and nutrition assistance, and 3% of direct care workers rely on cash assistance.
So not surprisingly, nearly half are relying on some form of public assistance, either to get health care through Medicaid or to put food on the table for themselves and their families through food and nutrition assistance in most cases. Next slide, please. Looking to the future, high demand and poor job quality could really jeopardize care for people living with dementia. And in fact, reports from the field suggest that that's already happening, right? We're hearing reports, although anecdotal, about widespread workforce shortages, high rates of turnover, and in general, really immense recruitment and retention challenges. Next slide, please.
A slide is displayed with a bar graph. The title says, from 2019 to 2029, the direct care workforce is projected to add more new jobs than any other occupation. The bar graph displays that from 2019 to 2029, direct care worker jobs are expected to grow by 1,276,400. Growth in fast food worker jobs is expected to be 460,900. In cooks, 327,300. Software developers, 316,000. Registered nurses, 221,900.
The demand for this workforce that we talked about is really showing no signs of slowing down. From 2019 to 2029, this workforce is projected to add more new jobs than any single occupation. So this includes not just home health and personal care aides, but also nursing assistants working in a range of long-term care settings. But job growth alone doesn't tell the full story. Although this workforce is going to add more new jobs than the second and third occupations with the most job growth combined, it sort of pales in comparison when considering all of the other job openings that will be created. Millions of workers will leave the field or the labor force altogether, either because they find a new job that's more materially attractive, or they develop a disability, or they simply age out of the workforce and retire. Next slide, please.
A slide is displayed with a bar graph. The title says there will be 7.4 million total projected job openings in the direct care workforce from 2019 to 2029. The bar graph displays that job openings for fast food workers are expected to be 8,266,000. For direct care workers, 7,427,400. For retail salespersons, 5,681,000. For cashiers, 5,586,000. And for waiters and waitresses, 4,757,000.
After accounting for occupational separations and labor force exits, we'll actually need to fill closer to 7.4 million job openings from 2019 to 2029. And as I said, dementia care providers are already struggling to recruit and retain enough workers. We heard from one of them today, which has led to high turnover and widespread vacancies in the field. So if we don't act now, these data show us that these challenges will worsen. Next slide, please.
A slide is displayed with the title, Addressing the Direct Care Workforce Crisis and Ensuring Quality Dementia Care.
So that was a lot of doom and gloom. Now for the bright outlook, right? What do we do about job quality? What do we do with this information? I'd like to now share a framework for job quality that could help stabilize this critical workforce and improve dementia care in turn. Next slide, please.
A slide is displayed showing the cover of a publication from PHI titled Caring for the Future, the Power and Potential of America's Direct Care Workforce.
This framework was drawn from Caring for the Future, which was a large report that PHI released earlier this year. I'm going to tease the content now, but I do suggest you read through the full report to inform your recommendations as an advisory group. Next slide, please. This job quality framework has 5 pillars: quality training, fair compensation, quality supervision and support, respect and recognition, and real opportunity. I'm now going to walk you through some examples of each of these and how they relate to the dementia caregiving workforce. Next slide, please. Let's start with quality training. A quality direct care job should ensure that all workers acquire the skills, knowledge, and confidence to succeed in their complex roles. Dementia care training content is now currently only mandated at the federal level for nursing assistants in nursing homes, and state-level training requirements vary widely. Only 13 states have enacted dementia care training requirements for home health or personal care aides. So to improve training for direct care workers who support people living with dementia, we should promote consistent dementia care training standards that are culturally competent, adult learner-centered, and infused with principles of person-centered care. We should also offer training that offers portable credentials so that when workers receive this training, they can take it from one employer to the next or from one setting to a new setting altogether. And all of this must be buttressed by a robust state training infrastructure. For example, for portable credentials, training registries that states operate can help centralize records and make it easy for employers to verify training and assess the training needs of new hires. Next slide, please. Turning now to compensation, a quality direct care job should enable workers to achieve economic stability, safeguard their health, and plan for the future. Not only is this a matter of social and economic justice, given the demographic characteristics of this workforce, but we also have to make sure that base pay rates are aligned with direct care workers' roles and responsibilities. Consumer acuity has increased across settings, in part because of the growing population of people living with dementia and rebalancing efforts. So those folks are now living at home, whereas in the past they may have been living in a residential setting. And wages really don't reflect the additional responsibilities that come along with assisting a population like people living with dementia and the skills required to provide them with quality care. Next slide, please. Let's talk a little bit about supervision and support. A quality direct care job should offer workers the support and supervision they need to work safely and effectively. Consistent, accessible, and supportive supervision, as well as connection to peer mentors and support networks, can help support direct care workers who are assisting people living with dementia, can help them hone their skills and be successful in the field. So while training can be helpful in sort of building an initial base of knowledge, supervision and other forms of peer support can help them hone those skills over time and develop them further, while also problem solving in the field. Next slide, please. Moving on to the fourth pillar, respect and recognition. A quality direct care job should honor the expertise, contributions, and diverse life experiences of direct care workers. These workers are often spending more time with people living with dementia who are accessing paid care than any other health or long-term care professional. Therefore, they hold critical knowledge about what they're observing in the field, and including direct care workers in care planning and decisions could help improve the more holistic picture of care for that individual. Next slide, please. And finally, the last pillar, real opportunity. A quality direct care job should invest in workers' learning, development, and career advancement. Currently, these jobs are pretty much dead end. There are a few rungs on the ladder in the caregiving space, and opportunities for advancement within caregiving are rare. With additional training and compensation, dementia care senior aides, just throwing out one possible job title, could educate and support other workers who are caring for people living with dementia. They could help family caregivers and workers identify and address behavioral triggers. They could support individuals living with dementia through care transitions, which can be a particularly tumultuous or vulnerable time for someone transitioning, for example, from a hospital back home. They could serve as a link between frontline care and the interdisciplinary care team, again, elevating the role of that worker in decision-making to ensure that health-related concerns are appropriately observed, recorded, reported, and addressed swiftly. Next slide, please.
A slide is displayed with the title Additional Resources. Additional resources are available through a link included in the YouTube description to this video.
So those are just a few considerations for thinking about direct care job quality. I've included for you a few additional resources that have more to say on this topic from my colleagues and others in the field. So I'm happy to share these slides so that you can go through them. But in the interest of time, I'd like to skip straight to the contact information slide. It's just a few slides from now. Thank you.
A slide is displayed with the name Stephen McCall, Data and Policy Analyst, and his email address, smccall@phinational.org.
So if you have questions or reactions to the content we went through today, feel free to reach out to me over email at smccall@phinational.org. Although our challenges are really great in this space for dementia care and long-term care in general, I'm always optimistic that we're sort of sitting at this pivotal moment where it feels like the transformative change that we know is needed is really within reach. And there are a range of strategies beyond just increasing compensation that we can do to make these jobs not only high quality, but competitive in a tight labor market. So thank you for your time, and I'll turn the floor back over to Carrie.